When we talk about clinical trials, we tend to focus on recruitment. How do we get more people to participate? But what if the real question is less about how we get more people to participate and what has to happen before someone is even in a position to say yes or no? For many people, the barriers to participating in clinical research don't start at the consent form. They start with trust, access, time, and whether the system has ever worked for them in the first place. Today, we're going to be talking about what it really takes to design clinical research for real people, not for ideal participants. Welcome back to Health Literacy in Real Life. On this podcast, we look beyond personal health literacy and instead look at how systems, organizations, and care models can make it easier or harder for people to understand and use health information in their everyday lives. I'm Megan Freeland, a public health pharmacist whose work is a blend of patient advocacy, patient engagement, and health literacy strategy. And today I am joined by Tiffany Whitlow, co-founder of Acclinate. Acclinate is a health tech company focused on improving health outcomes through community engagement, data, and technology. Tiffany is a recognized leader in advancing health equity, building platforms that connect underrepresented populations to clinical research and care opportunities. And through Acclinate's Now Included community, Tiffany has helped drive more inclusive participation in clinical trials while fostering trust between communities and the healthcare ecosystem. Her work sits at the intersection of innovation, impact, and representation, shaping a more equitable future for healthcare. And Lord knows we need more of that. So, welcome, Tiffany, and thank you for being here with us on the podcast.
Thank you so much. I am so excited for this conversation.
I am too. You know this already, of course, but for the listeners, Acclinate has a very, very special place in my heart. I've been able to support with some digital community engagement activities, health literacy activities, and I'm such a huge fan of Tiffany and her co-founder, Dale Smith, and the entire Acclinate and Now Included team. So we are going to be in for a great conversation.
Thank you. Girl, it's just the beginning. I say that I'm 6 years in.
I'm sure it still feels like the energy of the beginning. Things are still new and fresh and innovative and exciting. Yes?
I
No?
got some gray hairs. I got some gray hair. I've been in this thing. Yes,
That's
no, for real.
wisdom over time. Okay, so let's start from the beginning. To do this work with as much rigor and enthusiasm and excellence as you all do at Acclinate, you really have to be all in. Like, you really have to be invested in this mission. So I'm curious, how did you find yourself in the health equity and inclusive research space? What inspired you to work with Dell to co-found this organization?
Well, for me, I have the privilege of it really truly being my lived experience. And so I was actually given it for adoption because I'm half Black. And so my biological mom kept my 4 Caucasian siblings. I grew up in Alabama where race is as black and white as it gets. I was actually raised by an interracial family where I had an opportunity to understand firsthand what the lack of diversity look like in various spaces. I was often the whiter person in the room or bright skinned person in the room or black girl in the room. And so I feel like I was always kind of used or manipulated almost in that sense,
Mhm.
that allowed me to see the barriers and to feel like it was my personal responsibility to do something about the problems in healthcare. So, for example, I would go to the doctor and I could see my white mother being treated differently than maybe my black father. Also, I saw firsthand that my black father might be able to handle pain in a different capacity than my white mother. And so I think just being able to talk about it just as black and white as it really is helps me to be as, like my team likes to say, unfiltered as possible, because it's actually really hard for me to have a filter on. Also, the reality is it's just unfair. I mean, there's really
Mhm.
no other word for us to create drugs that are not as effective as possible and not spend money differently and work differently to have a better outcome for the majority of the population. And so if we know that the population is truly going to be more diverse tomorrow than it is today, why not work a little harder to make sure everyone has equal opportunities to participate in clinical research and to be a part of the advancement of medicines as we know it today?
Yeah, that is quite a lived experience. How do you think that shows up or affects your ability to work in with the communities that you're trying to reach and to really understand their perspectives, whether or not, the medical establishment would agree with those perspectives?
Yeah. So number one, I think by title, by my friends would say, look, and personality, I'm gonna get in the room. Like getting in the room with leaders is not the problem.
Mhm.
I'm gonna get in the streets with community. I've been involved with community. So I shared about my parents. The same parents were also very addicted to drugs the majority of my life. So I grew up really fast. So I was reminding them to pay their bills and be an adult. I was paying for my car at 15, affording my kids the opportunity to not have to do that nowadays. And
Mhm.
so I think like these things are the building blocks. I have mentors who, Raven Banks and Phyllis Johnson and Simone Reddick, who just poured into me as a young child and said, like, you are her, you deserve better. I have a non-traditional path. I didn't finish college. And so I think that's like the, oh, wow, like how the heck is she the one who gets to this point and she didn't even follow this traditional path? So I've always been disruptive. I'm always willing to say what you're thinking in your head. That's not just on reality TV. That is actually who I am in real life. My husband has to slap me on the hand sometimes. And so, that allows me to go into community and be like, listen, like when I had my first son, I got pregnant at 19, had him at 20. I was on WIC. We were on Medicaid. Like I understand what it's like to have to really truly build and to have everything around you kind of fighting against you. So
Mhm.
it's like I've been at a point where I've had to decide, am I going to pay for daycare? Am I going to pay for something else? Am I going to pay for the copay because this drug is really high? Or like, man, I don't want him to get off of all kids because insurance is going to be really high when he ages out of this thing, or I make more money. So I've had to like make their real life decisions. People like to say like I've lived a lot of life, so I can go
Mhm.
into community and say it the way it really is. Like I understand you through a shared lived experience, and I think by personality, I'm not afraid to meet a new person. And so I'm going to go in, I'm willing to ask the stupid questions, and just, allow to humble myself. It's funny, even starting the business, I've always driven luxury brand cars. That was my grandfather sewing into me, like, you got to have an Infiniti, you got to have a Cadillac, you got to have this thing. My husband surprised me with a Range Rover. I was like, I traded that Range Rover in for a Jeep. And like, I've joked with Dell and said from day one, I want to show up in community and I don't want to act like I'm better than. I am just me. That is
Mhm.
who I am here at our company. It's actually a struggle for me to be co-founder, chief development officer, because I enjoy being in community so much so.
So tell us more about that experience in your role as co-founder and as chief development officer. What do you do at Acclinate? And tell us more about what Acclinate is, what Acclinate does in the community.
We're on a mission to empower 1 million people to take actions towards better health. And that really means that we are working cross functionally, typically within clinical operations teams at pharma, or the various sponsors, to support the people who are going boots on the ground to recruit and enroll people for their clinical studies. I'm proud to say that in the time of starting Acclinate to where we are here 6 years later, we've seen industry shift, not only by mindset, but also in the way that they're spending dollars, to no longer say it's okay to go into community, hang up a flag, and then leave. They're truly making a sustained improvements and adjustments in not only the way they're spending their dollars to have a different outcome, but also in the partnerships that are available. You see people working cross functionally. So I'm really, really proud that Acclinate is doing that. We do that plus touch plus tech. You mentioned Now Included at the top of the call. Now Included is our community platform that is I'm the brainchild. It really was supposed to be, now is the time for you to be included and take control of your health. And so join us in community and doing that one person at a time, one step at a time. And on the back end, pharma gets to see a dashboard repository view of all of the great performance and campaigns we're helping to run on their behalf with them or equipping them with through
Mhm.
our Edict product. And so that is where that magic happens. You also get to know the predictiveness or likelihood of someone actually participating in clinical research through the Edict solution. My role is very inclusive. For a long time, I had to do everyone's roles.
Mm.
And so we're 47 people in. There's still times where there's a shift between should we be innovative or should we go back to the drawing board. I'm a person of faith. I say very openly to my team, I believe God gave us this gift and this vision, and because he did that, we already have the roadmap to get us all the way to the end and to provide value to whoever were to come and acquire us. And so we have this thing internally, it's called Tiffany's wish list. It really is all of the things now included should be and should have that continue to add value and drive that value. And so I work very intimately with our product team, with our community teams, with our marketing teams to kind of to bring that side to life, while also leaning in on commercial and customer success to support those teams with really making sure that we're not hearing what we want to hear from customers, but we're hearing also what those needs are, what those expansion opportunities are. And nowadays doing that in a data-driven way. So, it only took us 6 years to get here, Megan, but we're so excited to now be making those decisions with data.
That's wonderful. And those 6 years, I'm sure, were a lot of foundation laying and making sure that you were prepared to be able to make those data driven decisions. Now, one of the things that I do not have a conversation with any person at Acclinate without hearing is that Acclinate is not a recruitment company. That is not the essence of what you all are here to do. Can you say a little bit about that distinction between what you just described and kind of the image of a traditional recruitment company, and why is that distinction so important?
Yeah. So, number one, I want to give a little credit here to industry, because the reality is the only solution when we first started was a recruitment company. And we essentially had to come in saying, you cannot work the same way and get a different outcome. You cannot do that. And so that this goes back into the shift of spending and alignment. So we enable sites to do early and often community engagement and to be in community to find out essentially what people around their sites actually need, what they want, to really understand the barriers. Industry is known to work with the same sites and go to the same hospital systems.
Mhm.
And through that work, that's a lot of comfort. Okay. That I know that's easier for you. That's the easy path. But the reality is when we go ask the audience of people that y'all say you can't touch, they're like, I don't feel welcomed. Parking is a beast. There's just too many barriers. So we work to support through all of those other ways. And we typically enable a recruitment company. And so
Mhm.
the recruitment companies are set up to be very transactional. I have a clinical trial.
Mhm.
Pharma's paying me to help recruit. They need 30 people in tomorrow. I'm going to run ads. I'm going to go through the same partnerships. And I'm a recruitment company. And that's how they're used to working by transaction. Nowadays, you see pharma really understanding that if they want a big blockbuster drug, or if they want to be strategic and support a whole therapeutic area within the organization, they could do that early community engagement, get out there often, shake the hands, kiss the babies, make the relationships, and be intentional about it so that you can maintain those relationships. And then when there's a clinical trial opportunity, offer that opportunity to that person.
Right. So leading with the relationship, not leading with the opportunity and then saying, oh, well, how do we find these people to be a part of this? Not just coming in and planting that flag and saying, we have a trial. You want to sign up?
Yeah. Yeah. I mean, in major alert, Megan, is that how you want to be communicated with?
Not
Because
at
that's
all.
how I want to be communicated. I want someone to come with to me and just build a relationship and get to know
Right.
me before you're like, hey, by the way, can you do this thing over here for me?
Yeah, totally. So, what kinds of strategies or initiatives or programs have you all seen be most effective at building that trust and at preparing people or kind of priming people to be open to clinical research opportunities, especially when they might not be familiar with those kinds of opportunities?
So, number one, it is educating and equipping the people who we would call activation points, who are already in communities doing great work, with the knowledge that they need to be able to disseminate the messages to the people they're already in community with. So, these people are handling the local sorority meetings, and they're planning their local Jack and Jill, and they're engaged in a local church event. And so those individuals are who you need to educate and engage so that they can then immediately kind of pass that information on to their people.
Mhm.
Then for us, we have an inner circle. And so we have 69 individuals across 23 metro areas. These are people who are local local digital creators, influencers, ambassadors, people who might be passing various bills or working to pass various bills within their state. That here in Alabama, like Roy Johnson, who was working on getting prostate screening covered so that everyone has offered an opportunity for that. So we're working through these inner circle members to make sure that they're onboarded, they understand our brand, they understand what Now Included's biggest vision is. And it's like to be the community platform where you have trusted information and trusted people and resources to make the best healthcare decision for you and your family.
Yeah.
And so it's really just building out the inner circle, nurturing that inner circle, and then, hopefully one day growing it from 69 to 300 people. And really, I want to say enabling and equipping those people with resources. So
Mhm.
if they're hosting their local meeting, they might need a sponsor for their local lunch. We've worked with Little League coaches, and my husband is a baseball coach at Alabama A&M University, like working and supporting the team. Hey, okay, we'll feed your guys lunch. We want to bring them all into community. We want to ask them. So can we almost treat them like a focus group to say, okay, at what point are you as a college student making a decision versus your mom or dad, probably mom, making that healthcare decision for you?
So by this point in time, the numbers I imagine are speaking for themselves. And so they are helping you to make the case to pharma partners on why this community engagement matters and how effective it can be. Early on, when maybe you all were just getting started and perhaps didn't have the same quantity or quality of data that you have now, did you find it challenging to make the case to pharma to say, these activation points are legitimate, they matter in community, this will work? How did you kind of bridge that gap of knowing how important engaging these communities were through these activation points and being able to convince the pharma partners that this was a legitimate route?
If Dell was leading the conversation, there was probably money involved. And so, if I was leading the conversation back then, it was, just very transparent. It was, hey, listen, what you're doing right now isn't working and you should try something else. I think we would also see the shift of Black people starting to sit in leadership roles who then shared a lived experience and believed and understood what we were saying and what we were trying to do, who could then be internal champions for us.
Mhm.
I mean, I cannot talk about this without saying that the social and civil unrest that we saw from George Floyd and from COVID-19 had a major impact and really served as that launch pad for us in industry to really look at this in a different manner.
Yeah.
And even now, where diversity is a shadow, you still see better representation and better science, which at the end of the day, this goes back to my lived experience. You can call it what you want to call it, but it's the same thing. So that's just the reality.
Right. The words are the words, and it's not to say that they don't matter at all, but at the end of the day, what are we at? What are the actions saying? And are we still making this priority?
I mean, you just brought up another good point. That is, for some people, I've seen where DEI becomes an internal tool or resource where instead of essentially us focusing on diversity in clinical trials because that's going to take too long and too much work and too much money, let's focus on diversifying the workforce
Mhm.
or having a special DEI team that doesn't necessarily have the funds and resources needed to actually do anything.
So still a long way to go.
Yes.
We talked a little bit about why recruitment is sort of an incomplete way of looking at the challenges of inclusive research. And you also mentioned that you have seen and probably participated in a lot of the education that has caused pharma companies to shift their mindset and how they're looking at diversity in clinical trial participation. Are there any other factors that you think have shifted that perspective for pharma? And when you look out, I don't know, 3 to 5 years from now, what do you anticipate? What new challenges do you anticipate maybe having to overcome?
The adoption of AI for sure,
Mhm.
and the usage and making it standard to say, is it something that helps enable us? Is it replacing something that we're paying for today? And then just generally their understanding. Also, like I've thought about this one day when I was in the shower. I was like, the reality is you can spend $1 million going to do in very intentional community engagement work, and you might screen 80% of the people that you engage. Through that, let's just say a whole 10% of those people are actually qualified. And out of that, 5% are actually able.
Mhm.
Industry is going to have to understand that that is a major win still, because that still, all of that larger number is aware and able, so that in the future when they needed, and not then they maybe needed a clinical trial, or when they might qualify for a clinical trial, they can. So like if you think about just holistically, the biggest problem and challenge for industry that I think we're still trying to tackle is, what do you do with the people who don't qualify, aren't screening today, but have said they're interested? There's just no plan for the majority. And I would say they were the majority of the people
Yeah.
that I believe industry overall, I've seen spend money in different ways, where they were doing it one off by one off, clinical trial by clinical trial. And I've seen many pharma partners say, we want to do this by TA, because we're going to have many trials that are maybe underneath this breast cancer area for our organization, right? We're going to be doing many studies. And
Mhm.
so I think that is still really a shift. In the next 3 to 5 years, more people are going to shift that way, but you're still going to not have a plan for the
Yeah.
majority of the people that you're engaging. And you really truly can't rely on one middle partner to do that work. Like
Mhm.
that's why I dreamed of like a Google or a Walmart or someone acquiring Now Included, because you need someone who's huge, who has the resources and bandwidth to actually be able to build community, nurture community, and be intentional about the people who are no's now, maybes now, but could be a yes in the future.
Yeah, and the infrastructure to steward whatever that experience is. This is a really great point that I've actually never thought of this, but we all engage with the healthcare system, the public health system in different ways. And in a lot of ways, you can plot that out, like by demographic, by geographic region. You can kind of generalize to say this is a person's pathway through this system. But you can't do that with clinical research. There is no entity that has a clear view of what that standard pathway is. And so we don't understand what the baseline experience even is, that baseline patient journey through clinical research. Then how do you influence it? How do you improve it? How do you optimize it for different groups of people? And yeah, that's a great point, that there's no one that is taking the charge to say, we can play a role here and we can work on figuring out what that is.
Yeah, I mean, I really believe Google could.
Mhm.
And I really believe an entity like a Walmart, who has a healthcare system, who wants to continue to grow, who couldn't really wrap their hands around the clinical trial space the way that they initially intended to. But if you think about it, has a lot of consumer information on people who would be in Now Included. That's why Walmart was always my vision. I always wanted to walk down the aisle and see the section of drugs that was tested on people like you, or at least to give credit to the companies that were spending their money differently, doing early and often communicate engagement, like give them a score so that we knew, okay, you could trust this. Very similarly to what you can do with cosmetic products, where you see, oh, this is for Black folks and whatever.
Yeah.
So yeah.
You brought up Google. We talked a little bit about AI. Looking at those from a different perspective and knowing that people are largely relying on those types of tools for health information, for health resources, what does that tell you about how people are navigating the system today? And how does it affect your community engagement activities and the resources you're able to provide to communities?
Yeah, well, one thing I'm seeing is people in general are still creatures of habit. So, someone like my grandmother, or even my mom's age, what, born in 54, born in 36, they want to do things the way they already been doing it. So, I can try. My grandma got Life Alert she don't use. Okay, so with that generation, I believe it is slow and steady, and like usual, the my generation is going to be making their healthcare decisions. For
Mhm.
people like our kids, or ourselves, so maybe from the heck in Alabama, you can make healthcare decisions at 14. So I'll say from 14, into your 50s, 60s, you're leveraging AI because it's right now, because it can give you an aggregate view in 2 seconds, because it can handle a lot of data and scaling in just a matter of time. we're talking about AI, but I also want to talk about the AI that lives behind a product like TikTok. My kids who are in college are going to TikTok to say, okay, let me look up this product. Like my son has acne. He's like, let me look up this product. And it's their AI that's working behind the scenes, but the user experience, it doesn't scream AI. It
Mhm.
actually just screams user generated content. So it's a no brainer that community requires real engagement and this intimate ability to connect with someone. And the connection for that is whatever they're connecting on by disease state, right? Or, I mean, often by product. So I say people are more trusting than not of AI, because it gives me an answer and it takes my doctor 5 days to respond to me. I'm going to continue to go to AI. If you're a mom making a decision for your child, I want right now from whoever's going to give it to me. I don't want to have to wait for it. Like my baby needs help right this. AI is going to
Mhm.
give you that in a person. Even a 1-800 number is not going to give you that instant satisfaction. So
Mhm.
I don't remember we used to joke about like we're in a microwave society. These kids nowadays want Instagram. Yeah, we all do. So we're all here now. So I think that's the reality. I also really truly believe like Claude in the way that it can take control of your whole computer and really start to understand your brain is a little scary for some people, but
Mhm.
only sophisticated AI users are using that now. Like they're really leveraging the early adopters still. So I think we have at least a year. I'll say at
Yeah.
least before more people are using like a Claude, like a Chat GPT, where I never really leveraged Chat GPT because we use Gemini.
Okay.
But I know a lot of people, including my mom, who's like, oh yeah, I chatted it. And I'm like, okay, whatever. All right. That's fine.
And I
So
bet you're so proud too.
yeah, yeah, yeah. And the only thing I'll add there, Megan, is it's interesting because I don't believe people are distrusting of it. And
Mhm.
so for a while, if you think about it, Now Included could come up to you with a paper form. You're like, what is this I'm filling out? Because it's in your mind that you're filling something out. But the things online that you do, you're actually giving them more information and more access. You're accepting cookies and you don't even understand what they are. And they actually can do something bad with the information
Yeah.
versus like someone who might be trying to help you. So I think people don't really question it. I think that they want the answer and solution so much so that it could get dangerous.
Yeah, I completely agree. Someone posted on LinkedIn yesterday a statistic saying that I don't remember the exact number. I'll add it if I can find it later. But a concerning percentage of people, when it comes to health information through like ChatGPT, think that it is verified by hospitals or something. So it actually brings up this again this issue of health literacy because in order to be able to understand and how to use the tool as a supplement in a positive way to your health, you have to understand at least at a foundational level how it works. Where does this information come from? Who verifies it? Does anyone? Because if I'm looking at a response that I think is verified by my hospital, I'm going to treat that information differently than I might if I knew it was just spitting out, what it had read across the entirety of the internet.
I should
Mhm.
do a poll on this. I think that we have a larger group of people who don't even care where it came from
Mhm.
than the people like yourself who are like, no, I'm educated. I want to know if this is credible or not.
Yeah.
That verification credibility gap might get deeper
Yeah.
before it gets better just because people want. I mean, if you read what TikTok is doing, like if you read behind the scenes of small print and TikTok, girl, have you read it?
Yeah.
I did
Unfortunately, yes.
I did one time and I was like, okay.
So to wrap up, I would like to know what is one of the achievements that you are most proud of at Acclinate, or something that you're most excited about right now, and then what are your hopes and dreams for the future of clinical research?
Whew. I am most proud of my team and being able to employ 47 people and feed 47 families across the United States. I mean, truly, truly, like you could dream of impact, and that's real impact where people are sewing back into their communities and able to take care of their children. And I mean, I have a few like favorite success stories at Acclinate. John Forrest is one of them. You know, I saw him and his wife at Ace's birthday party recently, and when he started, he was single, ready to mingle, got married, had a son, bought a house, bought a car, and so and has really truly moved up the ranks. Shayla Wilson Thrasher, recently married, my head of community, really truly like the other side of my brain. She can complete my sentences. So if I had one more Shayla, we are hiring a head of community. And so, you know, I mean, truly, like there are people who are in this to win it. And I'll say, like me and Dale have differed here at some point. I believe that we should have people who are mission aligned. There was a period where I'm like, oh, okay, maybe you don't have to be mission aligned. I think the people who are mission aligned and here and doing a great job are the people who are willing to go above and beyond. And I don't want you to have to always do that, but willing to do that work, willing to work an hour after, willing to come in earlier, willing to work on the weekend. And when you're serving people, like you're serving community, I just fundamentally think that's required. Whether you're on a commercial team, that means you're going to have even better talking points to talk to our customers. Whether you're on a product team, that means you're going to really understand how to get behind the scenes or really impact the product in a meaningful way. So I really believe in order to scale, like that should happen. I am most excited for the potential to keep teasing out the conversation for someone who has, I want to say, endless resources, great resources, and the bandwidth and capacity to truly scale the vision of Now Included. Like we used to say, oh my God, this is $1 billion opportunity. And it is because people need it. It is because right now today we don't have a single place where, I mean, that's why you're asking a person, you're going to TikTok, you're looking at the videos, then you're going to ChatGPT or Gemini, like you're doing all these things because you don't have a single place. And so if there was a single place where we could come to before you needed it to really do that and to start normalizing the stories through storytelling and sharing authentically what is happening, I think like we'll start to see more people as just people. But optimistically, like I think about that like just in life. Like I wish I could just be a person all the time. Like I know I have to be co-founder, CDO, but like I'm just me.
Even though we know who you are, we know your role in the organization, I think the energy that you bring to everything that you do, including the community, really translates and probably is one of the reasons why you all have been so successful.
Oh, thank you. That means a lot. Yeah.
Of course.
I'm so optimistic for the future of our industry too. I mean, I think you asked like where do I see clinical trials? I see clinical trials being embedded in every opportunity and touch point that you have with a physician. And
Mhm.
so on the .com, in person, when you go to your ear doctor, you go to your dentist, it doesn't matter. Everyone is talking about it to help normalize that at a certain point in life, this could be a good opportunity for you. And I like to just bluntly say there have been white counterparts whose lives have been extended because they have participated in clinical research and we've been excluded or left out.
Well, thank you so much for sharing all these wonderful insights with us, Tiffany. It's been a great conversation, and I think you've really helped paint a picture of not just some of the challenges that the clinical research industry has faced, but how you all have played a major role in helping to overcome those challenges and what we might be looking forward to in the future. So, thank you for being here. If this episode was helpful for anyone or interesting to anyone, please do follow Tiffany. Tiffany, you're on LinkedIn. People can find you on LinkedIn, right?
LinkedIn, IG, all the things. I'm not one of those tricky names. It's Tiffany Whitlow _. So yes,
Perfect. All right. Thank you, Tiffany.
thank you.